In this video, I want to go over ways in which healthcare professionals treat OCD, because although it's sometimes difficult to diagnose OCD because symptoms can be similar to those of obsessive-compulsive personality disorder, anxiety disorders, depression, schizophrenia, or other mental health disorders, there are treatments for OCD. Yay! Thank goodness. Once a healthcare professional has diagnosed you with OCD, what can be done? Let's take a look. OCD treatment may not result in a cure, but it can help bring symptoms under control so they don't rule your daily life. That sounds like such a relief, right? The two main treatments for OCD are psychotherapy and medications. Often, treatment is most effective with a combination of these. Let's start by taking a closer look at psychotherapy. Cognitive behavioral therapy, CBT, is a type of psychotherapy, and it's effective for many people with OCD. The gold standard treatment for OCD is a kind of CBT called exposure therapy. What is it? When patients experience anxiety, they often try to avoid the things which trigger it. Avoiding anxiety temporarily makes them feel better, but it makes their fear worse in the long run. Instead of avoiding the situation, exposure therapy helps patients learn to face their fears in a structured and safe way. In the process, patients find that they get used to the anxiety and it fades over time. Exposure therapy works through a phenomenon called habituation, where your body basically adapts to whatever it is that it was fearing or it was having a hard time adjusting to. We see the same thing with all the different senses. For example, on a hot day, if you dive into a pool, you'll probably react like, "Oh my goodness, that's cold." Your body will feel the temperature of the water, but if you stay in the water over time, eventually your body gets used to it. The temperature stays the same, but your body adapts. The same thing happens with OCD. When a therapist systematically and slowly introduces patients to what they're afraid of, they feel the anxiety, but then they learn how to get used to it. They learn to adapt without resorting to compulsions, and what they were afraid of doesn't bother them anymore. During treatment, the patient and the therapist work together to come up with a list of the patient's OCD triggers. Then they rank the fears on a scale from 1 to 10. Next, the therapist exposes the patient to their fear in its mildest possible form. The therapist supports the patient until their anxiety fades. As their anxiety lessens, patients feel more in control. The obsessions and compulsions disappear. Once they've mastered some of the milder fears, they move on to the more challenging triggers. However, you may need medicine if psychological therapy doesn't help or if your OCD is severe. The main medicines prescribed are a type of antidepressant called selective serotonin reuptake inhibitors. An SSRI can help improve OCD symptoms by increasing the levels of serotonin in your brain. What should you consider before you take medication? Here are 5 issues to discuss with your doctor about medications for OCD. 1. Choosing a medication. In general, the goal of medication is to effectively control symptoms at the lowest possible dosage. It's not unusual to try several drugs before finding one that works well. 2. Side effects. All psychiatric medications have potential side effects. Talk to your doctor about possible side effects and let your doctor know if you experience troubling side effects. 3. Suicide risk. Children, teenagers, and young adults under 25 may have an increase in suicidal thoughts or behavior when taking antidepressants. If suicidal thoughts occur, immediately contact your doctor or get emergency help. 4. Interactions with other substances. When taking an antidepressant, tell your doctor about any other prescription or over-the-counter medications, herbs, or other supplements you take. And 5, don't stop taking your medication without talking to your doctor, even if you're feeling better, because you may have a relapse of OCD symptoms. Work with your doctor to decrease your dose gradually and safely. So the bottom line is, always talk to your doctor about the risks and benefits of using specific medications. Are there other treatments though? Yes, there are. Sometimes psychotherapy and medications aren't effective enough to control OCD symptoms. In treatment-resistant cases, a healthcare professional may offer you intensive outpatient and residential treatment programs, deep brain stimulation, or transcranial magnetic stimulation. I won't go over them in this video, but if you want to read more about them, you'll find the links to these treatments below this video. You might be wondering though, are there lifestyle and home remedies? Yes, there are. You can do these 4 things for yourself to build on your treatment plan. 1. Work with your mental health professional to identify techniques and skills which help manage symptoms, and practice these regularly. 2. As I said earlier, even if you're feeling well, don't skip your medication. If you stop, OCD symptoms are likely to return. 3. You and your doctor may have identified issues that can trigger your OCD symptoms. Make a plan so you know what to do if symptoms return. Contact your doctor or therapist if you notice any changes in symptoms or how you feel. And 4, and I kind of want to repeat this one too, contact the doctor who's treating you for OCD before you take medications prescribed by another doctor or before taking any over-the-counter medications, vitamins, herbal remedies, or other supplements to avoid possible interactions. How do you cope with OCD? Here are 6 ways to help you cope with OCD. 1. Learn about OCD by watching this mini-series. 2. Stay focused on your goals. Keep your recovery goals in mind, and remember that recovery from OCD is an ongoing process. 3. Join a support group. 4. Explore healthy ways to channel your energy, such as hobbies and recreational activities. Exercise regularly, eat a healthy diet, and get adequate sleep. 5. Learn relaxation and stress management. Stress management techniques such as meditation and deep breathing may help ease your stress and anxiety. And 6. Stick with your meaningful activities. Go to work or school as you usually would, and spend time with family and friends. This information came from these websites. You'll find these links below this video. We've reached the end of this mini-series on OCD. I've learned a lot about OCD on this journey, and I hope you have too. When it comes to OCD, I am not an expert. I'm not a doctor. I am not a therapist. I found information on OCD and decided to pass it on in an attempt to help you if you, like I am, are struggling with OCD. If you found this video interesting, please give it a thumbs up and leave a comment in the comment section below. Subscribe to my channel and watch this series from the start. In 2 weeks, I'll be back with a new video in this series on intellectual giftedness. So I'll be back with a new video in this series on intellectual giftedness. Till then, I only want to say 3 things. Thank you for watching, take care, and bye for now.